Your clinician may have directed you to this video as you've been prescribed the Humalog KwikPen. We don't cover the full injection technique here, but we will look at the Humalog demonstration pen. Before we get started, we need a few bits and pieces to show you how to use it. Our Humalog KwikPen demonstration device, which has a blue-grey colour, of course our friend Henry, a 4mm needle, and our sharps box. So we've got everything now, but before we get started, just a few disclaimers. This video is for device or instrument demonstration only. It does not cover the intricacies of proper injection technique, and you should refer to other content. This is for entertainment purposes only and may supplement your understanding of the devices or instruments presented. However, does not replace the advice given to you by your healthcare professional. This video does not form the part of any treatment plan or dosage instructions given to you by your healthcare professional. If you need help, then please contact your healthcare professional directly. The content of this video is put forth as entertainment purposes only, and this creator makes no claims, promises or guarantees about the accuracy, completeness or adequacy of the procedures and instructions contained therein. The creator of this content expressly disclaims liability for errors and omissions that any viewers of this video might declare that exist in the information as presented. No liability exists or can be ascribed to this content creator in the event of any accident or injury that might occur as a result of improper application or understanding of the procedures and information contained in this video. So let's get started with our Humalog KwikPen device. First of all, check your expiry date of your pen. Make sure it's in date by looking at the black box on the side of the pen. Check it is your pen and you have the correct insulin and strength. This pen is blue-grey in colour, which should be the colour of Humalog KwikPen. Humalog KwikPen is usually injected just before your meals. It is a fast-acting insulin. Remove the cap. You should see that the insulin should be clear. If it's cloudy, then you need to contact your prescriber or community pharmacist to obtain a new one if you don't have any more. Ensure the number in the window at the end of the pen is at 0. Now it's time to attach your needle. So let's take our 4mm needle and make sure the seal hasn't been tampered with, and then also check the expiry date. Once we've done that, we just peel back the tab and then attach the needle to the bottom of the pen. We need to screw this on hand tight in a clockwise direction. Once you've screwed it on, remove the outer cap and place it on the table for later. You can see here there's a green inner cap which we need to remove and discard. We now need to perform a test shot to ensure your pen and needle are working correctly. You can see here there is a small amount of liquid coming out of this needle already, which is usually normal. We need to dial 2 units, as you can see here in the window, indicates 2 units. We then need to point the pen and needle away from us and depress the plunger and check at the end of the needle to see if there's any liquid being discharged. Press the plunger and perform the test shot. In this case we can see nothing actually came out, so we can repeat this up to 6 times until we see the insulin coming out. If it still doesn't come out after that, then you may need to change your pen, so contact your prescriber or your pharmacist. In our case, After the 6th attempt, the test shot is successful. We're now ready to inject. We're going to dial up 10 units here as an example and inject this at a 90-degree angle into Henry. You can inject into your appropriately chosen site, for example the abdomen, at a 90-degree angle. We then depress the plunger fully and hold for 10 seconds to ensure that the full dose has been administered. After 10 seconds, remove the pen. Remember our outer cap from earlier? We have to recap the needle. So just flip the outer cap over onto a hard surface and slip the needle in safely. Then click that cap back on to make sure the needle is not exposed. Then point it away from you, turn it in a counterclockwise fashion to unscrew. Remember, we must never store our insulin pen with the needle attached. Once unscrewed, we can now place it in our sharps box. Recap your pen and remember to store this pen after opening below 30 degrees for up to 28 days. We're now done. Thanks for watching and I'll see you in the next one.